We all know that alcohol and our livers are not exactly best friends, but did you know that alcohol can affect other organs as well? Let's get into it. Number one, alcohol can injure the pancreas. So first of all, what's a pancreas? Well, this is a digestive organ that sits deep within the belly and helps us digest fats. It's also an endocrine organ. It's where insulin is produced. That's the hormone that helps our bodies manage blood sugar. And what alcohol does is it can increase risk for pancreatitis. This is inflammation of the pancreas. It leads to symptoms of nausea and vomiting, epigastric or upper abdominal pain, and it can be really serious. It can easily land you in the emergency room or the hospital. The severity of it does vary. I've seen some cases where people go to the ER and then the next day they're going home. I've also seen cases where people end up in the hospital for months, 3, 4, 5 months, with countless complications from pancreatitis. You can get abscesses, fluid collections around the pancreas that require drains. People end up with multiple tubes coming out of their abdomen. It can be a mess. And unfortunately, this disease is not at all uncommon. In fact, I definitely see a few cases every month. To diagnose it, a doctor will first take a careful history. He or she will ask you about things like alcohol use, also history of gallstones. That's another thing that can cause pancreatitis. Then he or she will perform a physical examination looking for tenderness in the abdomen. But really, to definitively make the diagnosis, a blood test is needed. This is lipase. This looks for an enzyme in the pancreas which should not be elevated in the blood. If it is, that's a sign of pancreatitis. Imaging like a CT abdomen can also be helpful. It can show signs of inflammation around the pancreas and also detect things like abscesses or other complications of pancreatitis. Now, treatment involves mostly supportive care. It typically will involve a stay in the hospital where at first you're given bowel rest, so nothing to eat initially, just to give the pancreas some time to calm down, and then plenty of IV fluid hydration and also pain control. Then over time, the pain subsides, nausea goes away, and you can start getting an appetite back. That's a sign that the pancreas is healing. But this is definitely one disease that you do not want to get, and heavy alcohol use definitely increases risk for this. Number two is heart disease. Now, wait a minute. I thought drinking red wine was supposed to be good for the heart. And while there are some studies in the past that did show some evidence that alcohol consumption can mitigate some of the risk for coronary artery disease, alcohol itself is toxic to heart muscle. It can lead to what's called a dilated cardiomyopathy. This is where the heart gets very big, and unlike other muscles in the body, this ain't like the biceps or the glutes. You don't want big heart muscle because a big heart is one that does not pump effectively. If it's bad enough, it can lead to symptoms of congestive heart failure. This is where you get fluid building up in the lungs, making it hard to breathe. You also get fluid that collects in the legs, causing swelling. In really severe cases, sometimes a heart transplant is needed. And this is also a condition that I do see from time to time. What typically happens is somebody will come in with evidence of congestive heart failure. They got all the signs, the shortness of breath, the leg swelling, and they'll end up getting an angiogram because one of the things you want to rule out is a very common cause of heart disease, which is a coronary artery disease or heart attacks. But if the angiogram is clear, that is to say the coronary arteries are wide open, you got to look for other causes of the congestive heart failure, and chronic heavy alcohol use is a big one. Thankfully, if you stop drinking alcohol, the heart can become stronger, but it may never go back to being completely normal. A third organ that is affected by heavy alcohol use is the digestive tract, and I'm talking about the whole digestive tract, from the mouth to the throat, the esophagus, the stomach, the intestines, and colon. Alcohol use increases risk of cancer in all of these places. It increases risk for mouth and tongue cancer, esophageal cancer, stomach cancer, and even colon cancer. And that's not all. Alcohol also increases risk of breast cancer and liver cancer, but perhaps surprisingly, not so much bladder cancer, which I was kind of surprised to find because beer and wine certainly affects your bladder and that it makes you have to go pee more often. And then finally, of course, we have liver disease. This really deserves its own video because alcohol causes all kinds of problems with the liver. So we don't have time to get into that now. I'll make another video on this later. Now, one thing I want to get into, when I say alcohol use, I'm not talking about just 1 or 2 drinks. This is heavy alcohol use over a long period of time, usually years and years. So if you've had the occasional glass of wine or pint of beer, I don't think you have to sweat it. You're not going to drop over dead from multi-organ failure. But long-term heavy alcohol use will definitely put your organs at risk. Okay, thanks for checking out this video. If you like medical or medical adjacent content like this, feel free to hit the subscribe button there or check out another video right here. And I'll see you guys next time.